Hello, we're doing our project on measles in the Democratic Republic of Congo. And I'm Shari Plyler. We have Shelby Hawk with us, Janelle Parkinson, and Megan Rude.
Measles information. Measles is an infectious disease, typically in children, that cause a fever and a red rash to appear on the skin. Symptoms can start to appear usually around 7 to 14 days after being infected. Other symptoms include runny nose, cough, watery eyes, and white spots in the mouth. It can become very serious and cause pneumonia and even lead to death. This disease is transmitted through a virus that spreads through the air and received through inhalation. It spreads very easily, and while uncommon here in the United States, it is very prevalent in other countries. The best way to prevent measles is to be informed. Our intervention to help the people of the Democratic Republic of the Congo is to host a measles clinic. The purpose of this clinic is to inform the people on what measles are, how to prevent them, how to treat them, and any other useful information they would need. We would also provide vaccines for those who would want it and let them know where vaccines are available once the clinic ends. Each measles clinic will be conducted on every Saturday for 1 month. This allows the people of the Democratic Republic of the Congo, Goma, to find the time to attend a clinic. Occur twice a year, during the month of December and during the month of May. This is when measles season begins and ends, and be aimed for children, but all are welcome.
Education on measles. Awareness of measles. It seems as though there isn't much awareness only to people in the community who educate others on vaccinations. Since this measles has been more of an outbreak and more children are getting it, the awareness part of the disease is put on the back burner, and treating measles is the main priority. One community worker named Alession Mapanga Wabaza, Alima's Alliance for Medical Action, has been raising awareness by shouting with a megaphone in the street of Kimbogo. 400 people have been killed in the Southeast Republic of Congo. 32,000 have been infected since 2015. UNICEF and Alima, working with the UN and governments to help with this outbreak. Vaccination is also free along with Medicare or medical care. The Alima helps mothers take their children to the UNICEF medical site where they are shared awareness as well as treatment for measles and prevention for measles. Education on measles continued. Alima has not only helped raise awareness of vaccinations in the Congo, but in such places like New Guinea and other places in the sub-Saharan countries in Africa. Wabaza states the other people reject the awareness of vaccinations and measles because of cultural beliefs and traditional healthcare practices that are much more of a holistic approach. Wambaza goes on to say that there is also reduced awareness because the expanded program of immunization is not organized, resulting in low vaccination coverage and poor handling of the cold chain. This leads to poor management of outbreaks and alerts. Yapi and WHO professionals are also raising awareness in Congo as well. Measles is a virus that is very extremely contagious. It originates in the nose and the throat and can be spread through coughing and sneezing. Measles is a little different than a cold. It can linger in the air for up to 2 hours. It can also cause a rash and a fever. The CDC says that for children, the MMR shot is a great way to prevent getting measles, mumps, and rubella. Make sure to stay out of contact even if you have had the vaccination. Okay, and then plans on educating. Establish a clinic and volunteers to help educate mothers and children on who to prevent measles and to make sure that they keep clean, they cover their mouths, avoiding contact with those who have had measles. Volunteers would ask to have a small tent and would use a megaphone to communicate to the public or some signs regarding what the volunteers are doing. Treatment plans for those who have the first stage of measles, the MMR shots, side effects of the measles, as well as the side effects of and continuous application. And talk to mothers and children about isolation of measles, which could last for 4 days.
are vaccinations. For intervention, we saw it best that we treat children and adults who have not received the vaccine and provide it to them. They will get the first dose at age 1, and the second dose can be given between 4 and 6 years old, but it can be given at 20 days after the initial dose as well. It has been seen that 2 doses of MMR vaccine are 97% effective against measles and 88% effective against mumps. 1 dose of MMR vaccine is 93% effective against measles and 78% effective against mumps and 97% effective against rubella. We would like to train the employees of the hospital in providing these clinics so that they can become self-sufficient and treat children as needed and more often.
So as part of the clinic, we want to educate everybody on how they can help treat symptoms of measles. There is no prescription or medication that can cure measles, and as such, it is the leading cause of death in children. And symptoms generally last for 2 to 3 weeks. However, there are many different treatments that can help save their lives of those who are infected. Educating those at risk of the disease really is vital. So there are some medications for the symptoms. Fevers present with a measles infection are dangerous when uncontrolled. Many times fever reducers are needed. So good options would be acetaminophen, ibuprofen, and naproxen. Never use aspirin in children or teenagers with a fever as it can lead to Ray's syndrome. And antibiotics might be needed for secondary infection with measles, such as pneumonia and ear infections, etc. But again, antibiotics wouldn't help cure the disease itself, but just the secondary problems that can arise. Children with vitamin A deficiencies are likely to have a more severe case of measles, so giving vitamin A supplements can help lessen the severity of the disease. So some home remedies that can be done. When possible, you always want to stay in contact with the doctor and keep them updated on how you're doing, especially how bad the fever is. Take it easy, get plenty of rest, and try to relax as much as possible. You want to stay hydrated, drink lots of fluids, especially while experiencing a fever. Seek for respiratory relief. A humidifier, if it is available, is a very convenient way to help relieve coughs and sore throats. And the measles infection causes eye sensitivity, so always protect your eyes, stay away from bright lights, and wear sunglasses.
Solution. We believe that providing the vaccine to these people will solve the issue because the vaccine is 90% effective. It would help in preventing the illness of measles. We also are providing education on the matter about the importance of vaccines and how to treat measles once acquired. We would lastly like to train the local hospital in providing these clinics so that they can become self-sufficient, and then all we need to do is send the vaccines to them.
Barriers. Some barriers that we would face would be like the language barrier. They speak French and most of us would speak English. How to market program without technology. Getting enough volunteers, staffing, and financial issues. E-healthcare. Because it doesn't reach rural places, and narrow our focus to an area that will be safe for our staff and clinic.
Overcoming barriers. We hire a translator to help spread the information about measles among the community. We also hire community members to market and advertise our clinic. We'll create pamphlets and flyers that can be easily distributed. And we will also partner up with Doctors Without Borders to get intern staff and volunteers for the clinic. We'll also have a GoFundMe page to raise money on our Facebook page, and we'll apply for grants, have bake sales, and team up with the Girl Scouts. And we've also decided to focus on providing vaccines in Goma for a safer place and area.
And these are just the sources we use to find all their information. And yeah, that's our idea. Thanks for watching.